Hi, and welcome to a little video for today. And I'm speaking with Dr. Darin Davidson, who's a good friend of mine, and we do lots of collaborations together. But the reason for talking to him today is that I wanted him to demystify the enigma that is mindfulness for us. But before
It's a tall task, Adam.
no pressure, no pressure.
Yeah,
But before we dive into that, would you like to tell us a little bit about yourself, if you don't mind?
sure. I'd love to. Well, first off, thanks for having me on your YouTube channel,
My
Adam.
pleasure,
It's
you know that.
great to be with you. And yes, you're a good friend of mine, and I am grateful to be able to collaborate with you on a lot of our overlapping interests. So just a brief overview of my background is I'm an orthopedic surgeon by training. And about 2 or 3 years into my clinical practice, which I subspecialized in orthopedic oncology, I became burnt out in my practice. I never, fortunately, had any substance abuse issues related to it or patient care issues related to it, but burnt out nonetheless. And that experience brought me back to some interests I had when I was in high school in sports psychology that I had lost track of following high school. And as I got back in touch with that and started to learn about all the updates in that field over the 25 years or so in between those times, I learned there was a lot more work that was done than was available at that time. And not only was there more mindset training work, but there was a lot more work on sleep, on recovery, on exercise, mindset training, and then meditation, which is, of course, what we're going to talk about today. And so about 5 years ago, I started a regular meditation practice. It took 6 or 8 months before I really got into a regular, dedicated practice, formal practice. But it's been going for the better part of the last 5 years. And my interests now are in bringing the skills of human high performance, which include all the things we just mentioned, mindset training, meditation, sleep, nutrition, exercise, recovery, into the healthcare system to help physicians and other healthcare providers be at their best for themselves, for their patients, for their families, for their friends, and be able to promote their own health and wellness, the health and wellness of those around them, as well as decrease the risk of burnout. And so that's my big passion. We have a lot of overlapping interests
Do.
amongst those ideas, which is where our collaborations come from. And meditation is certainly one of those areas that I think is really a big foundation to health, wellness, and pursuing high performance in all areas of life.
Yeah. Perfect. Thank you. Thanks so much for that intro. Yes, yeah. Just for anyone who's watching, we do have a clubhouse room that Darin and I founded together called High Performing Physician. So please check us out on there. So yeah, so going back to the sort of mindfulness and meditation then as well-being practice, they're often talked about in the same context and mentioned in the same kind of breath as yoga as well. But I personally find that quite a lot of people struggle to describe what mindfulness is.
Mm-hmm.
Could you help us with your sort of definition of what mindfulness is?
Yeah, I am borrowing from much wiser and more well-practiced mindfulness people than myself. I'm very early on in my practice, even though it's been 5 years. By comparison to many, it is like in the infancy stages.
Yeah.
And so I've kind of borrowed some ideas about how I would answer that. What is mindfulness from many of the really well-established teachers, and I think some of the common themes that they talk about is that firstly, mindfulness is a skill. And it's the skill of being aware and present in the moment without judgment or critique. And it's kind of, I think, helpful to sort of unpack some of the elements of that because they're important. And the first is that it's a skill. So it's something that we can all practice, we can all get better at. That also means, since it's a skill, like all other skills, if we don't practice it, we lose whatever ability we may have had. And so it really is something that needs ongoing attention and practice. The next part is about being self-aware. And that, I think, is one of the huge benefits, is that we learn to become really in tune with ourselves, how we're feeling physically, emotionally, psychologically. And that's really important because there sometimes are situations where we may feel a certain way, and our pattern behaviors from the past, or just the way our brain is wired, might give us a misperception. And as an example, if we're really excited about something, say we've been waiting months for a concert, favorite band, say, and you're really excited, that feeling of being really excited, if you compare that to when you're really nervous about something, the feelings inside your body actually can be quite similar. And so being able to be that aware allows us to identify the feelings, which takes a lot of the power away from them. So for example, if we're very nervous about it in our realm as physicians, let's say we had a situation in practice where we were very nervous about something, understanding those feelings and then being able to identify them can take away from a lot of the psychological or emotional distress, in a sense, of being nervous or anxious about something, just by being able to identify the feelings and name them.
Yeah.
There's a lot of good research behind that. So mindfulness provides that skill. The next part to the definition we're talking about is in the present moment. So being present. And that is so crucial, because so much of our time, for all of us, we're either thinking about what's coming up or what happened just before, and we miss out on what's happening right in front of us. And if we're not there right in front of us, right with what we're doing, we can't be at our best in that given moment. And I'm sure we can all relate to the idea of, being with another person who's important in our lives, be it a significant other, a child, a family member, what have you, and not being fully engaged in whatever activity you are doing with them, because we're thinking about the future, we're thinking about the past, basically anything about what we're doing right now. And we probably all can relate to being on the receiving end of that, when the person that we're with is clearly got their mind somewhere else. And so it's just so important to be in the present moment so that we can be at our best for whatever it is we're doing in that particular moment. And the final piece is without judgment or critique. And that kind of speaks to things like the inner critic. It touches on a little bit of imposter syndrome. Basically, this idea that we can be present with whatever we're experiencing without being critical of ourselves or others, and take away a lot of the kind of distress, or what in Buddhism might get called suffering, from that given situation, by virtue of separating a bit the event, the experience, from the judgment that we might place on top of it. And that might be a judgment about ourselves, it might be a judgment about others, but either way, a lot of times that judgment is what really gives us that feeling about the experience, is how we judge it or critique it or think of it. And if we can separate out a bit of being in the present moment and experiencing the event that we're in the midst of, remove the judgment, then we can be in a better place to not necessarily get carried away with any particularly negative thoughts that may come up. Okay. Sorry, that's a bit of a long answer to your question.
No, it's good. No, you broke it down really, really nicely. Thank you. And so in terms of judgment, is it more the negative stuff, or are you allowed to be mindful and be having positive judgments about and positive thoughts about things at the same time?
Well, I think where a lot of the distress comes from is the negative stuff. And I think we can relate to that very easily. But in a perhaps less obvious way, a lot of times the positive judgments also can lead to distress, just in the sense of we always want the thing to be positive, or to be in that positive experience. And if we attach too much to wanting that, then we're taking ourselves away again from being in the present moment. And so even though it may not have a very obvious negative connotation, because we're thinking about, oh, I love this, I'm excited about this, I'm looking forward to it, whatever, that's still taking us away from the present moment a bit. And getting a little bit more into the whole Buddhist philosophy of it, you, instead of wanting to avoid the negative things, you're starting to cling towards the positive things. And because nothing is permanent and like everything's always changing, clinging can also become a bit of a source of discomfort and distress as well. So I think it works both ways, although the negative judgment is certainly more intuitive about why we would want to avoid that.
Yeah, that makes sense. So you're trying to be very present was one of the things, but also be sort of judgment neutral, if you like.
To the extent we can. I mean, we're all human, and our minds do that. And that's okay. It's not about stopping that. It's about more identifying when we do it, so that we can then sort of separate out from the experience and the judgment of the experience.
Okay, cool.
That's my own amateur understanding.
No, listen, you you said this to me before, and I said to you, yeah, if you think you're an amateur at sort of like over 5 years, then that's people have been doing it for 5 weeks.
It's like that thing, relative to what, right?
Yeah, that's true. So you mentioned meditation, and yeah, I just wanted to delve a little bit into the relationship between mindfulness and meditation, and the commonalities, and if and how they differ. So for example, you can practice mindfulness without being in a meditative state. Is that fair to say?
Well, from my understanding, yes, I think that is, because in a sense, meditation, first off, there's different sort of types, right? And I think two main ones would be mindfulness for sure, and there's some various types under that too. But another, for example, would be transcendental meditation, so TM.
Okay.
And that's a different sort of philosophy way of doing it.
Okay, yeah.
I think that the take-home point, as a lot of the really well-known meditation teachers say, is that the point of meditating isn't to become a better meditator. It's to be able to develop these skills that then can make our lives better. Because if it was just to be a good meditator, really, I mean, what's the point to that?
Yeah.
That doesn't really help anything. It's about having those skills present in our lives so that we can benefit from them. And so, yes, we can, on the mindfulness branch of meditation, we can have a formal practice, and that's where we can develop these skills and further our abilities. But the real big payoff is when we bring that into our life so that we are present, that we aren't critiquing and judging everything, that we can be there with whatever experience is right in front of us. And that's the whole point behind the practice.
Yeah. Okay, cool. Thank you. So you said there were different types of mindfulness, and I think when we spoke about this before, you talked about two main types. Is that right?
Yes.
Quite useful if you could tell us about that.
Yeah, and I probably should have added a third one at that time. So we'll talk about three.
Let's do the three, yeah.
So, and again, this is, just to reiterate, this is specifically mindfulness. Now, this isn't TM and other types of meditation, but within mindfulness, I think many people would agree that there's what might be called like concentration or single point focus, where you're the term suggests, you're focusing on a single object or a single experience. And that very often is the physical sensations of breathing, but it could be like focusing on an object in front of you. It could be really focusing on anything, a single point thing. And the idea with that is that we focus our attention on that particular experience. And when our mind goes somewhere else, which it invariably will do, we just, without judgment, kind of note that and come back to whatever the object of focus is. Another main type is contemplative mindfulness, or open awareness, others might call it. And that's basically to just let your thoughts wander.
Okay.
And when we come up with a thought, to kind of note it, again, without judgment or critique, and then sort of let it pass, and kind of note that the thoughts that come up, these thoughts aren't anything of substance in and of themselves. I mean, physiologically, they're like random firings of neurons in our brain. But when we practice in that way, we can very quickly sort of see how the power behind many of these thoughts is the power we attach to it. And by practicing in this way, we can learn to note these thoughts as they come up, not give them any power, just see that they're present, and then let them fade away. Yeah, which is a really powerful, empowering, really skill. And the third type is loving kindness meditation, and that's kind of borrows a bit of TM, because there's phrases we would say over and over, and that's what we're focusing on, the phrases and the feelings with the phrases. And the idea behind that is to generate kindness and compassion for self and others. Yeah. Excellent. And so I think all three are really important, and provide somewhat different skills that are all very complementary. Yeah. So you mentioned before, I'm just going to tack onto this about the inner critic, and so this negative mind chatter. And we both know that the vast majority of our tens of thousands of thoughts a day are negative and repetitive. And we
as coaches try to explain to people that they can just ignore these thoughts. You don't have to attach any significance to these thoughts. And it sounds to me like the contemplative model that you mentioned, the second one, is probably quite good for that. So you can get a negative thought, and you can acknowledge it, and then you can just say, but it's not serving me, so I'm just going to let it go. Is that fair to say?
Exactly. I think that's very well said. The only thing I might add to that is the added part is sometimes the inner critic, it's not necessarily thoughts that conceptualize in our mind, but a feeling that we get in our body. Okay. And the development of awareness through mindfulness practice helps to identify those feelings as well. And there's a lot of good research that shows that for a lot of our emotions, particularly the negative ones, being able to name the emotion diffuses a lot of the power of that emotion just by naming it. Yeah. And so having both of those aspects, like you say, the identifying of the thoughts when they come up, and it's not that we're ever going to get rid of the inner critic, it's not possible, but to identify it quickly so that we kind of note those thoughts, identify that they are just thoughts, that they're not necessarily reality. In fact, they're almost never a reality, and just let them go is really, really powerful. Trying to get rid of the inner critic is kind of a futile endeavor. It's not going to happen. And so it's better to learn how to work with it and not let it have any power. And
to use a sort of Brené Brown term, some of these negative thoughts are just stories that we're telling ourselves, aren't they?
Exactly.
We can just ignore those stories. So you said, so you've been practicing mindfulness and meditation for over 5 years. Which is your personal favored form of mindfulness that you practice?
I don't have one. I do a lot of, I guess I should back up and say, within, even before we break down into those 3 types we talked about, a lot of the practice can either be guided meditations, and there's lots of fantastic apps out there, for example, or off of YouTube, you can get lots of great guided meditations, but there's also just, set a timer for however many minutes and not have any guidance, just follow whichever style or type of mindfulness you're doing. So I tend to do the guided meditations. I try to incorporate all 3 of those types. I typically, or at least more recently, have always been doing a loving kindness in the morning. So my practice is 10 minutes in the morning and 10 to 20 in the evening. And then the evening could be either a single point focus concentration type or a contemplative type. And sometimes, even though it's a guided meditation about one, I end up flipping over into the other. And I think that's okay, because the point is to practice the skills. And if you kind of switch to a different style in the midst, I don't see how that could be a problem, although the mindfulness purists might have something to say about that, and that's okay. I do it without judgment, so I think it's okay.
Absolutely. That does kind of go against the grain somewhat, doesn't it, to be criticizing people not doing it in a way that they want it to be done. So do you do some mindfulness activity kind of upon waking first thing, or is it after your breakfast, or when do you do it?
So my typical routine is after I get up in the morning, we'll do it as one of the first things is to do 10 minutes of mindfulness, and then some breath work training stuff, which can be done mindfully, but it's not, technically speaking, formal mindfulness meditation practice. And that's just the routine that I've gotten into. And then in the evenings, a similar sort of thing around the time of getting my younger son to bed.
Okay. So not at your actual bedtime itself? No.
Okay. Although there definitely is some meditations geared towards sleep that can be very helpful as well. But my practice is earlier in the evening.
And I think you said to me before, you try and get your son to do it with you as well, don't you?
Yes, that's kind of become part of our routine. It was easier when he was a baby, a little bit more challenging now that he's 4, but it's something he's familiar with, which I think is pretty cool. And so the kind of hope there is that because it's something that's very familiar and he can identify with it, as he gets a bit older, to a point where he can start to do a little bit of meditation work, that it'll be something that is kind of a part of what he knows.
Yeah. And so can I ask then, on a day-to-day basis then, if you if for some reason something comes up, someone's not well at home or something, and you skip your morning one, or you skip the evening one, do you notice that, is it the things that, do you find that you're not able to manage your emotions better or something like this? There's some way, discernible way, that you notice that you've skipped it, and you can attribute it to that?
That's a great question. I mean, I certainly notice it, just as far as sort of cognitively knowing that for whatever reason you weren't able to do it.
Yeah.
I'm not sure that I kind of get an internal feeling that's necessarily any different, having missed one or two, or as the case may be. I sometimes fall asleep in the midst of these meditations. So if that happens, I don't really feel different afterwards either.
Yeah, of course.
But I certainly have heard of other people kind of saying that when they don't get their regular practice, maybe more so after missing several days in a row, that they start to feel that.
Okay.
So it's a little bit hard to answer that question. I think the other thing to add is that mindfulness, yes, there's the formal practice that we've been talking about, but there's also the just living mindfully. So really, we can be practicing mindfulness, doing whatever it is we might be doing during the day, because all we need to be doing is being truly present with what we're doing, and feeling and noting the experiences, physical, emotional, mental, that are coming up for us. And so even if for whatever reason there wasn't time in a day to do the formal practice part, well, we could go for a walk outside and be very mindful and still be practicing. And perhaps practicing in a much more pragmatic, useful way, because it's that practice in life, not just the formal meditation practice.
Is that things like noticing nature more, like noticing the trees and plants and whatever?
Yeah, that's a great example. Absolutely. And mindful eating is another really good one that has some benefits as far as not overeating, by really feeling the sensations, not just of the food, but also in our body, allowing us to recognize when we're full. Even if we haven't finished all the food that might be in front of us, which for many of us is something that comes up. So living mindfully is even more important than the formal practice.
That's interesting. So you say mindful eating. Is that just when you notice that you're sated, or is it that you're noticing the flavors and tastes and things more than you would normally?
I think it's all of that.
I think consciously, concentrating.
And one of the kind of classic examples that I've come across is like taking a single raisin in your mouth and really feeling like the different textures of the raisin in your mouth and the flavors of the raisin in your mouth. And then, like you're saying, the sensation of when your stomach feels full, and, recognizing that before, we all inhale. I mean, as physicians in healthcare, we've all learned how to eat really quickly because there's not a lot of time. And that is really not conducive to mindful eating.
No, that's true. It's true. So, as a sort of extension to that previous question, how do you feel that you've benefited over the 5+ years, psychologically and physically, through your mindfulness and meditation practices?
Well, I think there's been a tremendous difference. Probably the best way is to ask my wife and kids. That'll probably be the best determinant of other people's observations. Not that we want to be dependent on other people's opinions, but they can give us some insights that we might miss. But I think one of the biggest things, well, I guess there's a few. Some of the biggest things are, one, being able to separate out between whatever event might be happening and my reaction to it, so that we're responding to an event rather than reacting. So, for example, not becoming frustrated with things that don't require frustration, but in the past I would have, just because you just simply have a quick knee-jerk reaction, essentially. So I think that's a big way. I think with the inner critic / imposter syndrome aspect, I've noticed a lot of differences. Not that it's gone away, but that I can identify it maybe a little bit sooner, so it has a bit less power than previous, which is very helpful. I think there's definitely some benefits with focus and concentration. tasks that you really need to be focused on because they might be difficult to do or technically complex, or there's significant repercussions if something goes wrong. And so to be able to be focused and refocus quickly if there's some kind of a distraction, by virtue of having practiced mindfulness, I think is really helpful as well. And then just recognizing emotions. I mean, we all have times where we feel down, where we feel anxious, where, you name it, and being able to identify how we're feeling.
Yeah.
And by that, I mean physically, emotionally, mentally, psychologically, I think is really helpful. And certainly, with the whole COVID pandemic over the past year and a half, I was glad I had this practice and had some skills, even if they weren't that well developed beforehand, because it is useful.
Yeah. Yeah. So that's really interesting. So it sounds like it has quite a lot of benefits on mindset and growth mindset, and helping with negative mindsets, and also with emotional intelligence, the sort of self-awareness and the not being the regulation, the emotional regulation side of things, not flying off the handle sort of thing.
Yes, I think so. I think so.
Yeah.
Or at least when we do get upset or angry or frustrated or whatever it may be, it doesn't last as long. And as I've heard one meditation teacher talk about, it's not that you, for example, get angry less often. It's that you recognize it faster so that you decrease it sooner, so that we don't do as many stupid things while we're angry.
Okay. Yeah. That's good.
Things we would later regret.
Yeah. Okay. Yeah. So you can
There's a big difference between being angry for like 10 seconds versus 10 minutes.
Yeah.
As far as self-defeating things we might do.
That's true. So you still have those human emotional reactions, but just more controlled.
I think so. I think that's a good way to describe it. Yes.
Yeah. And are there any other benefits of mindfulness and meditation that you can think of that maybe you personally haven't experienced, but it's in the literature that says so you have benefits on sleep and things like that?
Well, absolutely. I mean, there's some excellent research done and books written about all of the physical benefits: decreased inflammation, improved sleep, cardiovascular, hypertension. I mean, all kinds of things. A lot of these are more in very long-term types of meditators, but they definitely exist. There's evidence behind it. And then there's, of course, a lot of application from the MBSR, mindfulness-based stress reduction programs that Jon Kabat-Zinn originated, as far as treating chronic pain, for example, with mindfulness, and that being a very powerful adjunct to other treatments. Because again, what is it about chronic pain that becomes so difficult to manage? It's not simply the physical sensation of the pain, but it's also the judgment and the additional suffering that goes on by identifying as being in pain, or how we perceive those physical sensations, and so that can be very powerful as well. I've seen papers on mindfulness, again, as obviously not a treatment for chronic diseases, but something that helps people manage them and cope with them, and perhaps that helps to lessen the severity of them. But even if it doesn't, it helps with how they cope with it. And so that in and of itself is a very helpful thing.
Yeah. And how about with mental illness, depression, anxiety, and things like that? Do you know of any studies that demonstrate the benefits?
I'm just thinking, nothing really jumps to mind. But again, somewhat related, there's good research that gratitude practice can help manage depression. And part of a gratitude, like a proper gratitude practice, isn't just writing down the things you're grateful for. It's truly experiencing them, which then brings you back to the mindfulness about the awareness, being able to fully be present to experience those events or whatever it may be that you're grateful for during the day. So off the top of my head, I can't think of any specific examples or papers about anxiety and depression, although I'm sure they're out there, because again, a lot of the issues behind anxiety and depression has to relate to how we think, how we perceive our thoughts, how we orient them either in the future for anxiety or in the past for depression, and being aware of our thoughts and being able to come back to the present could only be helpful.
No, logically it seems to make sense to me. If you can help with chronic pain, then you can help with chronic psychological dysfunctions as well, can't you? I guess by changing.
Actually, as we talk, what comes to mind is Judson Brewer, who's a psychiatrist and I believe a neuroscience PhD as well, has a whole anxiety program that's based around mindfulness as an intervention that supposedly is very highly effective. I don't have firsthand knowledge of it, but I've heard him on various podcasts talking about it, and he uses mindfulness as a kind of core pillar, I guess would be fair to say, of those types of programs. So it is out there for sure.
That definitely makes sense. So in your opinion, if someone were thinking of starting a mindfulness practice of their own, maybe having watched our video, how could you advise someone with that interest to start on that journey?
Well, I think, though it sounds simple to say, it's less simple to do, but it's just to get started and to just try. And if it doesn't take at first, to try again. I've heard lots of people talk about, and my own personal experience was similar, that you have a few attempts at trying and it doesn't really stick, but then you kind of either read a different meditation teacher's way of explaining it, or a different meditation teacher's guided meditations, and for whatever reason, their style, their presentation, the way they write or talk just clicks. But the research is pretty clear that as little as 6 minutes a day can make a difference. And I think that for many people, they would describe that once they started and actually, tried for several minutes a day for several days in a row, you can see enough of a difference fairly quickly to convince you that this is worth pursuing. So I think it really is to just find a way to get started and give it a try.
And 6 minutes, it doesn't sound like very much, even in the most busy of lives.
We can all find
it's achievable.
some time for that.
That's been fantastically informative. Darin, was there anything else you wanted to mention about mindfulness or meditation before?
Well, I guess the one other thing that comes up a lot, especially in high performing areas or walks of life, is people worry that meditation is going to take away from that edge that allows them to be successful. And that's a very common misconception that is out there. And in fact, it's quite the opposite. Because of all the things we've talked about, it provides so many benefits that even if someone is in a very competitive area of life, it's not going to take away from their edge. If anything, it gives them more of an edge by virtue of training the mind to be present, to be non-judgmental, and that will only be helpful.
No, that's a good point. That reminds me of I think there's a couple of studies that have been done recently and are probably ongoing with the American military. I think the Marines, it might have been actually, the practice of loving kindness meditation, mindfulness, yoga have been shown to reduce the feelings of homesickness in the young recruits, the trauma that they experience, like help them be better able to deal with trauma from kind of battlefield trauma and whatever, active duty trauma, and also going back to pain, helping them with the pain that they may be experiencing from an injury or something.
That all makes perfect sense.
Excellent. So if people watching would like to reach out to you, how can people get hold of you, and what just tell us what sort of things you're up to at the moment as well?
Well, within this walk of life, I'm developing my coaching consulting practice with physicians and other healthcare providers, bringing these high performance skills we were talking about before, of which meditation is a important one, and bringing that into their daily routines and lives. I'm happy to speak with anybody about these topics. I think they're really important. I can be found on my website. Do you want me to give the information, or
do it?
Just post it in show notes?
I'll do both.
Website is just my name, Darin Davidson, DarinDavidson.com, and on there are links to the social media sites. On LinkedIn is the main one that I use, but also Instagram and Twitter, which I very infrequently use. But there's links to those as well. And to be honest, I can't remember the handles or the IDs or whatever
That's
they're
fine.
called for any of those three.
Yeah,
But there
that's
are
fine.
links on the website to those, as well as a
Cool.
contact form if people want to reach out and discuss any of this further.
I'd heartily recommend that people do. It's not just mindfulness and meditation, but you have a whole heap of expertise in all of the areas of wellness and well-being, and many other things as well. So reach out to Darin, please.
Yeah, and don't forget our clubhouse
yeah, absolutely.
That's right.
Yeah, our club, High Performing Physician. Yeah, we need to get a few more rooms going, which we will do. It's fine.
We will do that for sure.
Lovely. Okay, well, I'll say goodbye then, and thank you so much for your time. It's been really fascinating and really informative. So thanks so much. Appreciate it.
Well, thank you, Adam. It's been great talking, and I'm happy to do follow-up conversations anytime.
Oh, totally. No, I'll book you in for that. All right. Thanks, mate.
Great.
Cheers.
Thanks, my friend.
Bye.
Bye.